As we've heard today, organ donation saves and transforms the lives of Ireland's transplant recipients. The gift of life given by our donors, both living and deceased, is celebrated and cherished publicly every year on this Organ Donation Awareness Week. This year, as Carol has said, will mark 60 years of organ donation and transplantation in Ireland. That first transplant patient was a young man with end-stage renal failure who subsequently survived for 2 months. At that time, dialysis in Ireland was in its infancy, with only 2 dialysis machines available in 1963 for the entire country. It is heartening to report that over the intervening years, developments and advances in medicine, such as renal replacement therapy, respiratory support, high-tech medication, and mechanical assist devices for heart failure treatment have allowed us to offer hope to more patients suffering from failure of a vital organ. While these therapies help support patients' well-being, solid organ transplantation remains the only life-saving option for those with major organ failure. Organ failure, as we have heard, has an enormous impact on the lives of our patients, young and old. Often, lives on hold, and for many, it is a matter of life and death. Advances in transplant medicine, immunosuppressive drugs, tissue typing, surgical techniques, and organ support and preservation technology has enhanced our ability to offer organ transplantation to more recipients. At present, in our kidney transplant recipients, they have a median survival of 21.7 years after a first deceased donor transplant. 5-year survival rates for heart transplants are 80%, liver transplants 85%, and lung transplant 75%. Many of our recipients have decades of added life. These added years of life bring joy, opportunities, love for some children, and the ability to return to work. None of this would be possible without the generosity of our donors and their families. Our living donors give of themselves freely to help a loved one driven by enormous generosity, and will in time be allowed to give that in an altruistic, non-directed way once legislation supports it. Patients who can avail of a living donation for renal failure have excellent outcomes. They generally wait less time, they spend less time on dialysis, and sometimes can avoid dialysis altogether. We remember particularly our deceased donors and their families who, in the midst of grief and sudden loss, find it in their hearts to think of others. That decision to donate can give life to up to 7 people. This week, I would encourage everyone to let their families know their wishes about organ donation. Have that conversation, please. It is your family who will let us know what it is you would have wanted. From my work in intensive care, I know that it can really help families to make the decision to donate at the end of life when they have had that conversation with their loved one. When the wishes of the donor are known, respecting and honouring that wish can bring comfort in a really dark and difficult time. As the Minister has alluded to, we continue to work to ensure that organ donation is offered as an integral part of end-of-life care where appropriate to our patients. To that end, NOCA, with our organ donation nurse managers, many of whom are here today, clinical leads in organ donation, our colleagues in Organ Donation Transplant Ireland, with the help of our public and patient representative Martina Goggin, have developed a potential donor audit to look at our practice, assess how we're doing, learn from the knowledge gained so we can achieve that aim of offering organ donation where appropriate to all of our patients. Those of us who work in intensive care units, Transplant Medicine and Organ Donation Transplant Ireland have the honour of caring for our donors and families and our transplant community. We thank all of our donors. You are the linchpin of the service to our people. I want to try and use some words in Irish to try and express the feelings and emotions around this wonderful act of human kindness. Bhvalam cúpla focail as gaeilge úsáid, chun na mothúcháin seo a chur in úl. Dús, sorrow, brón. But tempered, tásúlagam, with hope, which is dóchas. There is loneliness, uignas, which I think is a wonderful word, as gaeilge, but that is tempered by love, grá. Grief, the word for that is dólas, but An sin tá misnach ann, which is courage. Boss, agus ba, death and life, but also pride, broad. Míle buchas to all of our donors. Tá siad in our guidsmita agus padracha. They are in our thoughts and prayers. For our deceased donors, may they rest in peace. Ar yesh te greva nanamacha dilsha. Good Margaret.